Welcome back to the channel. I know it's been a few days, a few rough days, but we have something more exciting to revise for, at least in my opinion. Now, today's topic, the general exam, the general inspection more specifically. Okay, so before we get into this lovely man I have depicted here, all right, definitely not scary, we will get into something a bit more compact, something a bit more memorable for you to take home from this video. If anything, this is what I want you to remember. When you walk into the patient's room, hopefully you will think of these two things. Number one, how is the patient positioned in the bed? Number two, how does the patient look? Okay, now firstly, what position are they in? In an orthopnic position, a platypnic position, or a tripod position? Of course, they could be in a number of different positions, but yeah, just keep this in the front of your mind. Okay, it would give you some ideas into what the patient may or may not be suffering from. Now, how does a patient generally look? Spickle T pure is your mnemonic. Spickle T pure, S for skin. Now, could be many different problems. Okay. So I've given you some examples. It could be dry. Alternatively, yes, it could be, wet. But if you see dryness, you could be thinking of hypothyroidism. Does the patient have bleeding? Okay, small subcutaneous bleeds, which could be petechiae purpura, ecchymosis. So these can be classified as your hemorrhagic diathesis. Does the patient have discolorations? Maybe a rash, could be lupus. It's always lupus. Or could it be something kind of not mainstream, something like uremic frost, okay? Or maybe it's something simple like jaundice. So carrying on, P for pallor, I for icterus, C for cyanosis. Cyanosis can be peripheral or central, okay? That's why you want to look at the face, the oral cavity, and the things like the hands, the nail bed. Moving on, cyanosis. Yeah, we said cyanosis, clubbing. All right, so a very simple test you can do is Shamrot test. All right, place the patient's fingers together. Try and look for the window. Lymphadenopathy, all right, is the lymph nodes enlarged. All right. Next, edema. All right. Now, edema can be pitting and unpitting, or it could be ascites, depending on where you're looking. All right. Now, T can be split into two categories. One is the overview category, the general overview category, which I've just mentioned here. All right. This will be the thyroid. Okay. Is the thyroid enlarged? Have they got a goiter? Is there any nodules you can see? Otherwise, this next category I want you to focus on is the vitals. Vitals. Temperature, pulse, respiratory rate. Okay. So this is the general thing you want to take home. However, if you want to go into a bit more detail, here it goes. Okay, so with the head is termed as cephalia, and you have different types: Churi, Dolicho, Micro. Churi is tower head, Dolicho elongated head, Micro is micro. Then you could think of Zika virus causing such things. Okay, now move on to the face. You must have seen this a lot of times, fasciis or fasciis, however you want to pronounce it. So yeah, there's different types. Febrillis is termed as red face, shiny eyes, as you can see here. Lunar, moon face, it can be to do with Cushing's disease. Obviously, their head is not like this, right? They have more of a enlarged moon face, like a full moon. Mitralis is to do with obviously the mitral valve, which is associated with your cyanotic individuals. All right, they'll have this reddish discoloration, or as the textbooks I've seen call it, a livid color. And yeah, so that's the mitral stenosis. And finally, nephritica. Nephritica is to do with kidney inflammation, kidney diseases. Basically, you have facial, or more specifically, edema of the eyes. Okay. Also, with the face, you could have things like exophthalmos, right? Having this buildup of cholesterol, i.e., the foam cell deposition around the eyes. Okay. If we want to get a bit more information from the head, we can look at the eyes, we can look at the tongue. The tongue, oral thrush, all right, is this patient taking corticosteroids? Pernicious anemia is the tongue, if the tongue is smooth and red. Okay. Leukoplakia is any whitish discolorations, maybe to do with tobacco smoking. Macroglossia, is the tongue enlarged? If so, is it because of acromegaly? Perhaps. Eyes, all right. Some simple diseases. Jorgens, is it dry? Jaundice, is it yellow? Pale, is it pale? Wilson's, all right. Do you have this greenish kind of discoloration around the iris? Also, is the eyes asymmetrical? Is it a cranial nerve defect, cranial nerve 7? Is it exophthalmos? Is the eyes bulging out? Is it because of hyperthyroidism? And like I mentioned, xanthelasmus. I don't know if I pronounced it right before, but yeah, that's how you pronounce it. Okay, there's other things, of course, you can look for, but yeah, let's just keep it mainstream. Let's move on down. You could talk about the neck, but the neck would be associated with more congenital diseases. However, if we want to look at more acquired diseases, you can look at JVD, jugular venous distension. Is it because of congestive heart failure? Is it because of tamponade or pericarditis? Carotid, look at the carotid artery. Is it pulsating? I mean, is it enlarged? Perhaps, of course, you would need to use auscultation method to identify this, but it could be indicative of, so water hammer pulse, a type of pulse, we have this sharp increase and decrease, which is aortic insufficiency. Parvus etardus, this is in the exam we've seen, which is Latin, I think. I think it's to do with like early and late. It's something, the meaning is something like this. Aortic stenosis would be a causative agent of this. And goiter, like I mentioned, it could be hypo or hyperthyroidism. Moving down to the chest, of course, you look for scarring with any part of the body. Respiratory expansion, all right? Is it symmetrical? Okay. Is it paroxysmal? Maybe there is a flailing rib pathology, or maybe there's just some respiratory disease that's going on that's inhibiting this symmetrical bilateral expansion. Something more simple to look out for: barrel chest, pectus excavatum, pectus carinatum. Maybe this is a problem to do with emphysema, with barrel chest, with excavatum carinatum. Maybe this is a vitamin D deficiency. Maybe this is a problem to do with maybe this is a problem to do with rickets. Okay. Now moving on to the abdomen, making our way down. Abdomen, simply think caput medusa or any other liver diseases which causes this portal hypertension. Speaking of portal hypertension and liver diseases, you could have ascites, okay? Or perhaps there's some other pathology going on, such as Cullen or Turner's sign, in which you have this kind of this deposition or extravasation of blood in the subcutaneous tissues. Okay, now let's move down towards the legs. Is the legs, well, could you see some varicose veins? Varicose veins are likely to be seen, or DVT. A good place to actually test if you have pitting and unpitting edema would be on the shin or the ankle, the medial malleolus. Okay. And looking at the hand can be useful to indicate certain things such as flapping asterixis. Basically, when you raise your hands to 90 degrees in association to your forearm, do you have this flapping motion? This could be some problem to do with the CNS. Okay, it could be CO2 retention. Looking at the nails could be very useful. Like I said, clubbing. Also, you can have tar staining, of course, excessive smoking, clubbing, and also you could have infective endocarditis. You could have these pinpoint hemorrhages on the nails. Okay. And looking towards the palms, you could have these lesions such as palmar erythema, indicative of liver diseases, or other lesions such as Osler nodes or Janeway lesions, also associated with the infective endocarditis. Okay. Now, of course, this is not everything, all right, but I think it's a good starting base, all right. If you want to add some stuff on top, then definitely go for it. But yeah, this has been a general overview of the general inspection, all right. I think I will upload in the next video something to do with the heart, something heart related, maybe an ECG. But yeah, for now, hope you guys enjoyed. See you in the next video.